Hello everyone, and welcome to this LINEA Webinar. My name is Lottie Howard-Merrill, and I'm the Research Fellow for the Learning Initiative on Norms, Exploitation and Abuse, or LINEA. It's great to see so many people here today, and I think there's some people who are still joining the meeting. So yeah, welcome, and we're really glad to have you. So before we start, I'll just tell you a little bit about the LINEA project. LINEA stands for the Learning Initiative on Norms, Exploitation and Abuse. And our project sits within the Gender Violence and Health Centre at the London School of Hygiene and Tropical Medicine, or LSHTM. LINEA is an international and multi-pronged project looking at how social norms theory can be used to prevent the sexual exploitation and abuse of children and adolescents globally. We've included our Twitter handle and our webpage in the presentation, and we encourage you to enjoy the LINEA Network mailing list to learn about future webinars and other LINEA updates via our website. So today we're really looking forward to this webinar, which is entitled Engaging Men in Transforming Restrictive Social Norms that Uphold Gender Inequality. Today's presenter is Piotr Pawlak. He's an external consultant, and he's actually been involved before with LINEA, developing our curriculum to prevent age-disparate transactional sex between adult girls and adolescent men. Adolescent girls and adult men in Tanzania. Dr. Piotr Pawlak, he's a development specialist and senior gender expert working with multilateral development partners globally. He's a researcher and published author or co-author of numerous reports on working with men for gender equality and transforming restrictive gender norms and limiting masculinities for better development outcomes. He's designed, pilot tested and evaluated several educational curricula to engage men and boys in gender equality, including caregiving, child nutrition and health, fatherhood and ending gender-based violence. He has a PhD in human rights and peace studies. So today's presentation is going to last about 35 to 40 minutes, and there'll be time for a Q&A at the end. So if you can use the chat box on your screen, that would be great, and you can enter your questions during the presentation and then afterwards during the Q&A, and I'll read out your questions to Peter then. I'd also like to point out that we're recording this webinar and we're going to upload it onto the LINEA YouTube channel. So you'll be able to have a full recording afterwards, and we'll also share a PDF of the slides in a follow-up email. Please make sure to keep yourself muted during the presentation, and yeah, hopefully it all runs smoothly. So I'll pass over to you, Peter.
Good morning, good afternoon, and good evening, colleagues and friends from all over the world. It is truly a pleasure to be here. And I am as excited, hopefully, as you, in sharing some of my experiences in engaging men in transforming and shifting some of the restrictive and limiting gender norms that uphold gender inequality. Over the last 20 years, there has been a broad consensus in the field of women's empowerment that men and boys need to be engaged for sustainable gender transformative efforts. Already there is a body of expertise and grounded knowledge about what works well and what does not in engaging men in transforming restrictive social norms that uphold gender inequality. Donors, institutions, organizations, and networks, advocates and researchers like myself have been effectively, yet not without challenges, engaging men for gender equality. So in today's presentation, I will review what male engagement is and will discuss some of the principles of working with men for gender equality. Lottie, if you can just switch the slide, please. Thank you. I will present some of the common approaches and best practice across all levels of the ecological model and share with you how I have adopted, translated, and tested these in practical settings. Specifically, I will zoom in on practical activities with men to transform inequitable norms at the individual and community levels in 3 development settings. Firstly, multi-sectoral women's empowerment program in Bangladesh, child nutrition program in Papua New Guinea, and prevention of transactional sex between adult men and adolescent girls in Tanzania, a program developed in collaboration with colleagues at the London School of Hygiene and Tropical Medicine with activities planned but not yet tested. Next slide, please. So let me start by asking, if and how have you engaged men? Tell me in a short sentence, if you can, by typing in the chat box, which sector and geographical location you have worked on male engagement and how, whether you're a donor, policymaker, an NGO, program implementer, researcher, or practitioner. Perhaps we can take 10 seconds to hear from you by typing in the chat box. What is your experience? Great, I see a colleague from Tanzania, welcome. Colleagues from Ghana. Great, we see more and more colleagues. Pathfinder International in Ethiopia, welcome. Community mobilization intervention in Uganda as well. Guyana, welcome back. Fantastic, we have a program designers and implementers joining us. Welcome as well. Staff of organizations working on empowerment and engaging men in health. Great. Fantastic. So it looks like we have a very strong group of practitioners and program implementers representing diverse NGOs. Once again, welcome. It's great to have you here. I think this is a fantastic group of individuals, both with the strong experience in male engagement, but also those that they work indirectly with men. So this will allow us to have a vivid, constructive conversation, sharing of knowledges, and of course, have a Q&A at the end of this presentation. Welcome back those who I have talked before, and welcome those who are joining for the first time. Can I have a next slide, Lori? Fantastic. So let me begin by bringing us on the same page and conduct a quick review of what male engagement is. No simple answer exists, in my opinion. After all, men and boys play multiple roles in the lives of women and girls and in the society at large. What I believe male engagement is to engage men by unpacking these many roles that they play and to examine the concept of power that underpin these roles. The role of men in gender equality is generally conceptualized in three main ways. As gatekeepers who hold power in society, this approach recognizes that men hold the vast majority of positions of power and have, to date, largely upheld inequitable patriarchal norms and protected their traditional prerogatives rather than seek more universally beneficial standards of equality. As allies and partners in the struggle for gender equality, and what that means, a more inclusive framework that envisions a positive, culturally transformed role of men. And as stakeholders and beneficiaries or co-beneficiaries. This conceptualizes men as participants and promoters in the process of creating and reinforcing gender equality. It also sees men as benefiting from this process through what they gain from more equitable families and societies in which they live. Related to this last framing is also the concept of gender synchronized programming. So rather than focusing separately on engaging women and then also engaging men, gender synchronization reflects the premise that the gender equality efforts will be most effective when conducted through optimal collaboration and coordination. More specifically, gender synchronization theories suggest that both men and women shape and perpetuate gender norms in society, and true social change will only come when all members of a society are engaged to create this change. Next slide, please. So Donors, organization, expert, practitioners like yourself and like me, who directly or indirectly worked with work and continue working to engage men, have defined several principles, don'ts and do's, so to say, of such work. And some of these include: when engaging men generally, it is important to amplify the voices of men who already support gender equality. Even though men engage in harmful behaviors and must as such be held accountable, not all men uphold norms that support gender inequality. It is essential that we engage men in ways that acknowledge and meet their needs, their unique needs. This includes taking into account the high rates of violence, depression, substance use that men experience, or simply their unique reproductive and sexual health needs. When engaging men, we must not overlook the diversity of men in our population. This means their diverse sexual orientation and gender identity, race, ethnicity, class, even socioeconomic and relationship status, in addition to religion, faith, or age, among other social markers. Engaging men means working with men and women to transform limiting and restrictive versions of manhood. It is really about recognizing that some common gender norms and dynamics are harmful and seeking together to shift these norms. Finally, I believe that efforts to engagement should never be pitted against those aimed at women and girls. Rather, it is really about gender transformative and gender synchronized effort that engage all populations. Next slide, please. So I would like to now focus on some examples of programmatic best practice in engaging men, and later on share with you a little bit more how these have been applied in practice. Because of the limited time, I may not be able to go into the details, but one particular overarching practice stands out for me, and which is the need to conduct formative research when developing programs to engage men. Although it seems like an obvious practice, I have seen it on firsthand, often being put on a back burner by the program designers and implementers who, driven, for instance, by the sudden emerging funding opportunity or, let's say, donors' agenda, are keen to add men as a target group and move on fast to achieve desirable outcomes. This is especially true, in my opinion, when such program is being added as a component to an existing women's empowerment programming. On the contrary, I believe it is essential to speak directly to men in addition to women and girls when designing male engagement program or evaluating its effects. We really need to understand men's diversity, their diverse needs, vulnerabilities across really the life course, structural barriers to being service clients or agents of change, and the impact on transforming gender norms on them and their lives. Furthermore, it is essential to ensure that all research with men follows ethical standards, especially around sensitive subjects like relationship violence. Another overarching practice in programming with men that perhaps have been slightly overlooked or not sufficiently addressed, in my opinion, but which has a significant importance, is to address the non-heteronormative sexualities and gender non-conforming identities. This issue come up when people reflect on and particularly discuss subject of gender norms and roles, particularly among the younger men and younger generation, and it's especially evident when engaging young men and boys in school settings. It is crucial that these programs engage men in a way that is inclusive as possible and anticipate how to address the needs of non-heteronormative and gender non-conforming participants. In my opinion, furthermore, an important consideration for programs with men or programs that directly engage men at the household level is that non-heteronormative women may not have husbands who influence their opportunities and decision-making abilities. So one inclusive practical practice of engagement is to target male household members generally, as opposed to husbands only. In addition, shifting deeply entrenched social norms take time. As men adopt and practice more gender equitable norms, attitudes, behaviors, they often face pushback from their peers, family, or their communities in which they function, operate, and live. Therefore, effective male engagement programming should be multi-sectoral, intersectional, long-term. Furthermore, leveraging momentum to expand across to extend change across all levels of society is particularly important. For example, when you look at the graph, as men involved at the individual level, for example, through sharing information or emphasizing benefits of gender equality or promoting alternatives to some of the more harmful, limiting versions of masculinity, as they begin to deconstruct or reconstruct those masculinity and power dynamics in their own relationships, they can also engage through social network, reference groups, or collective actions to spread and reinforce these social norms, these new social norms at the broader community level. For example, through the involvement or role play and engagement of role models, unpacking gender norms on a broader community level, or working with influential male community members around some of these issues. This certainly also works the other way around. So changes at the institutional policy levels, for example, availability of paternity leave policies, can also contribute to positive shifts in norms at the community and then individual level. Next slide, please. So globally, programs that engage men have focused on several key sectors, from violence against women and girls prevention and response, to health, to education, from care work and fatherhood, to women's empowerment, decision-making, and political participation. So for the purpose of today's webinar, and considering my personal programmatic experience in helping organizations around the world to develop, design, implement, and then evaluate effective efforts to engage men in shifting some of the norms, some of the gender and social norms, I will focus on three sectors, namely violence against women and girls, health, and care work and fatherhood. These three sectors have also been well utilized in the LINEA project to address transactional sex between adolescent girls and adult men in Tanzania, project that Lottie, myself, Anna Buller, who is also at the London School of Hygiene, Tropical and Medicine, as well as Laurie Rorai from New York, have been involved very deeply for the past couple of months, if not longer. So using these three key sectors, first, I will tell you why I worked with men in a given sector and what approach or good practice was available to me at that time, and then how I translated these practices in individual and community level actions in three development contexts described on the beginning. That's Bangladesh, Papua New Guinea, and Tanzania. Next slide, please. So there is a general consensus among researchers and practitioners that engaging men is critical to preventing and addressing violence against women and girls. The rationale vary, of course, but generally falls under two themes: feminist justification and practical observations. Firstly, perpetrators of violence, particularly sexual gender-based violence, are overwhelmingly male. Secondly, violence against women and girls is shaped by social constructions of masculinities and their manifestations across all levels of social ecology. Thirdly, violence is also a concern to men, and by ending violence, men can benefit directly or indirectly from ending it. Finally, it is widely recognized that the multifaceted approach is needed to end and prevent violence against women and girls. In the male-dominated societies, those in positions of power in public policy institutions and with the ability to address violence and promote gender equality are typically men. So evidence suggests several common approaches and good practices with men in transforming norms that justify, reinforce, and sustain violence against women and girls. Of course, the list presented today is not exhaustive, and there is so much more to be said, and so much more to be unpacked. But I will focus on just a few and how that these examples have been done, these practices have been then translated into practice. So let's go back one slide. Thank you. So at the individual level, group-based gender education and reflection, which allow men to reflect on their attitudes and beliefs about gender, violence, and so on, has been promising. Discussing cost of abiding rigid masculinities and feminists, as well as power imbalances that underpin violence, has been a very promising, very good practice. Such education and reflection can also have impact at the community level, so connection, which I have described earlier. Male and female participants have opportunity to reflect on violence in their communities. They can imagine non-violent, peaceful communities and lives in those communities, and as such can mobilize themselves, but also others to bring about the change. At the community level, for example, engaging men as active bystanders is a practice based on the idea that men already hold gender inequitable views and subscribe to nonviolence, but perhaps don't speak out. And I've seen it in many settings when men will say, I support this and these behaviors. I am pro peace, but I am forced by the community. I'm expected by the community to behave one another way, to think, to rational my life in one another way. So programmatic strategies include here equipping men with knowledge and skills to intervene when witnessing acts of violence or violent attitudes and behaviors. I will break that down a little bit later in the next slide, how that looks in practice. At the institutions or policy level, political mobilization and activism is a crucial strategy for driving social change. Some examples may include making public spaces more safe for women by encouraging men to speak up in instances of public violence, or conducting, for example, occupational specific trainings, for instance, for police or security forces who can be trained on, let's say, providing confidential, sensitive, survivor-centered assistance. Next slide. So here I would like to share with you examples of how I translated some of these common approaches and good practice into action. For example, in program in Tanzania, developed, as I mentioned earlier, in collaboration with the London School of Hygiene and Tropical Medicine, men will learn, and this is activity that is planned in the curriculum, not yet tested. Men will learn to recognize acts of violence as a prerequisite to avoiding and preventing transactional sex with adolescent girls. They will be provided with a list of concrete strategies, so anything from a disapproving look, ability to interrupt or distract someone, ability to talk to a friend about his behavior in a non-confrontational way, to things like caring for a friend who experiences problematic behavior. Men in the group will then be encouraged to put themselves in the shoe of someone who witnesses violence or violent attitude or behavior and wants to change it. They will be divided in pairs and role play very realistic scenarios that are inspired by incidents from their own communities and their own lives. By role playing, men will practice what and how they would react and gain confidence at the same time to do so outside the very charismatic educational group setting. Furthermore, by practicing positive behavior, they will also model positive norm. The strategies and the skills to be an active bystander are also transferable, designed in a way that are transferable, and men in the group will be encouraged, excuse me, will be encouraged to also share these with their social networks and reference groups, with other men in their communities. An example of a community level activity in PNG is based on the evidence that some of the most promising and successful ways of preventing men's use of violence are those created by men themselves. For example, in a peri-urban community of Port Moresby, where I worked last year, men were asked to create a community action to promote peace and non-violence. First, they were provided with examples of similar projects implemented in the nearby communities similar to them, characterized by the similar levels of violence, socioeconomic status, social and gender norms. They were then given full flexibility in terms of the project format. So we're able to choose from a dance, a song, a community performance, to the development of a community forum, even sewing or drawing awareness-raising materials like a kilt, a poster, or a banner. Anything that was really speaking to them and was culturally appropriate and recognized by their own communities. Men were then guided to identify community influencers and think about the kind of collaboration that they will need to make their action possible. And that ranged from organizing a schedule, securing a local community venue where they could perform, to even having a blessing of a male community leader with a power and decision-making abilities. A requirement, however, for the activity was that men will consult with and develop their prevention activity with the input from and participation of women and girls in community, with particular focus on engaging with community women's committee in that particular community. The result actually was quite impressive. It was a huge drawing that men collaboratively created, and which depicted them participating in care work, holding signs of peace, and marching to declare the commitment to violence-free families and communities. Next slide. As I mentioned, focus on the health sector. The health sector is one of the most established when it comes to male engagement. Engaging men in health intervention is critical for a number of reasons, and some of these reasons are that sexual and reproductive health is directly linked to men's, which makes it only logical that programs engage men when seeking to improve health outcomes for women and for overall household and the communities. Furthermore, research has also shown that engaging men in family planning intervention can increase gender equality and can lead to positive health outcomes for both sexes. Male engagement programs have found that when given the option, men actually do have a keen interest in being part of a family planning or healthcare decisions, and in creating enabling environment to improve the health of their partners and families as whole. So programs in the health sector can engage men in a number of different and effective ways. Just to mention few, at the individual level, programs can provide knowledge and education about sexuality and reproductive health. They can present men, for example, with contraceptive options and methods, or discuss health consequences of for instance, unsafe sex or consequences of transactional sex on their health and health of their partners. They can encourage men to question traditional masculinities and femininities and to reflect on the related positive as well as negative implication of gender norms on health. I do, however, want to emphasize at this point that sharing knowledge is effective but should be complemented with other components in order to change men's health attitudes and behaviors around health. So while some results can be seen with group activities alone, this coupled with, let's say, counseling and or mass media campaigns are shown to be most effective. At the community level, working with men, working with community members and building and reinforcing linkages between the community and local health services is a common good practice. At the institutional policy, building the capacity of service provider, local governments and institutions, or forming partnership with local NGOs increases the likelihood that the programming with men will be sustainable and effective. Next slide. So here are two examples of how that adaptation of a common approaches and good practice can look like in the field. In a program that aimed to improve nutrition outcome for children under the age of 2, men participated, for example, male in Papua New Guinea, actually in autonomous region of Bougainville, participated in a male engagement program. The program has invited a male leader first of all, the men have been invited to a cooking demonstration, which was a part of a simultaneously implemented program in the same community, which was run with their female partners and children. Then a local male nutrition specialist have been invited, and men, together with their female partners and children, have been provided with practical information and skills to prepare simple nutritional food. At the end, men were invited to practice also food preparation, an act which was absolutely outstanding in those community and which broke down the community status quo that men are unable to cook. The demonstration brought together not only the entire family, but also evoked excitement of the whole community. It furthermore linked the existing long-term harm program with the male engagement component and further created the synergy and complemented efforts of a local health service provider to address child malnutrition. Next slide. I'm just conscious of time. So, in many parts of the world, deeply entrenched social norms suggest that men are expected to be sole breadwinners and women are expected to be entirely responsible for caring for children and household. However, in the recent years, what we see is that women's participation in paid employment has increased, but men's participation in unpaid care work has not. So this has created double work burden for women between their paid employment and unpaid care responsibilities. In addition, we see that many studies have already showing us that men's involvement in care has been found to be associated with improved physical and mental health for men. When men are engaged in childcare, they develop deeper relationship with their children. There is also evidence that when men are engaged with childcare, they may adopt more gender equitable attitudes and behaviors. So here are also some not exhaustive examples of a common approaches and good practice in transforming inequitable norms through men's involvement in care work and fatherhood. At the individual level, for example, creating safe space to discuss fathering or fatherhood responsibilities have been well utilized. In such space, men can be provided not only with knowledge and skills to be involved fathers, but also reflect on and discuss their fears, their challenges, but also opportunities of involved fatherhood. What does it mean for them? What does it mean for their female partners? And what does it mean really for their families? At the community level, programs can engage role models to speak up and model positive versions of masculinities based on involvement, care, love, and equality. At the institutions and policy level, introduction, as I already mentioned, introduction of paternity leave policies allow men to take on larger role in care work and household responsibilities. So some of the practical example of that would look like as follows. Next slide, please. In a program in PNG, which I described earlier, a widely respected community leader, local community leader, was invited to a male engagement program to demonstrate male participants how to hold a baby and change diapers. So how it looked like in practice first, as a group, men had an opportunity to reflect on the social barriers to childcare, then reflected on their own relationships as children with their fathers. They discussed impacts, both positive and negative, of their father-child relationships and the benefits of having their own father being involved in their own lives as children. Many men have talked about the power of father-child relationship and the joy, the emotional stability, the physical well-being that came with it. With this in mind, men then were asked to try to hold a baby doll and experience the powerful emotional connection and an emotional aspect of it. Then the male community leader modeled the skill of changing a diaper, and then men had the opportunity to practice this. It was really incredible experience to see it because the event was groundbreaking. There were tears of excitement, pride, but also sense of opportunity in it. Next slide. So as I am going to wrap up, I would like to reflect on some of the experiences helping organization to engage men in transformation or shifting social norms, inequitable social norms that uphold gender inequality. These are really based on my observations and my direct work with these organizations, and then evaluating some of the programs that have been implemented. Firstly, what I see is that programs struggle to address diversity of men in the population. Often, activities do not reflect critical dimensions of men diversity. And as I mentioned earlier, that includes gender identity, gender expression, sexual orientation, race, class, religion, or even their own relationship status, as majority of efforts really do focus on heteronormative men with wives and children. Programs with men not always think about the scale and sustainability for achieving long-lasting impacts. There is, for me, still a question of how to sustain the change initiated by the program over time. Are men who graduate from a program change makers? Are they ready to be the role models? I am asking it because I have met and seen many of these graduates, many of men who went through the programs, who were willing and eager and energized to take the steps forward, to bring the message for gender equality to a wider community, but may not, in my opinion, have the full capacity to do so. So how do we sustain it beyond the life of a program and ensure that these efforts, that these movements that we create are not just one-off project outcomes, but really a sustainable movement that are really faithful to the objectives of our programs? Many programs focus also on individual and community levels only and struggle to build effective multi-sectoral, intersectional, and long-term efforts that actually span across all levels of ecological model. To me, the question also remains around funding needed to do so, or wanting and needing quick results to be shown, or project aims versus the men's and women's actual needs. So again, the need for formative research comes into the play, which I have talked about in terms of the best practice. Through my involvement in designing, implementing, and evaluating male engagement programs, I have met groups of outstanding staff and facilitators committed to the vision and mission of their own organizations and their programs with men. However, their understanding and practice of gender equality is influenced by the peers, families, communities where they live and function, and may have not always been aligned with the program objectives. From the practical perspective, for me, this remains a gap to be addressed if we want to effectively engage men in shifting social norms that really uphold gender inequality. So I will stop it here and open the floor to any comments or questions.
Great, thank you so much, Peter. That was absolutely fascinating. And yeah, I can tell that people are really engaged because we've already got some questions coming through. So I'll start reading them out. But yeah, I'll just encourage everyone else, if you've got a question, to add it to the chat box, and I'll pose it to Peter. So one of the first questions that we got was from someone called Alexandra, and she's asking about the ethical standards and considerations that you have when you're working with men, especially on violence prevention. And yeah, she's asked you to speak to your experience, but also if you have any documentation or resources that would help with this.
Absolutely. I think, it is essential that we look back at some of the documents and some of the guidelines developed, for example, by WHO in ethical considerations for the research around violence against women, and really ensuring that these golden standards are also implemented when doing a formative research, implementing programs, and then of course when evaluating program outputs, program impacts, specifically around interpersonal, family, household-based violence. I will be happy to share with you some of the kind of golden standards and documents that have been developed and widely used. One of them, as I mentioned, is the one developed by WHO.
Great, and there's a related question which is asking about the specific challenges. So at the end, you're talking about challenges with engaging men, and you spoke quite a lot about the caregiving challenges and like the caregiving program, but are there specific challenges related to preventing violence against women?
I think, many of the programs have framed all discussions around violence prevention with men, in that men actually benefiting from preventing, responding to violence, or eliminating violence in their lives, but actually and just really focus on the benefits, and have really, in my opinion, avoided or missed the conversation about that men will have to and need to give up some of the power that they have been holding on to for so long. So I think one of the challenge is to how to avoid this kind of soft approach that focuses only on benefits, and avoid the conversation of giving something away in order to gaining something on a more community, family, or society level. I think that's something very important, and needs to be done skillfully in order to be effective.
Thank you. We've now have a few questions about measurement, which are very interesting. And one of them is about measuring or ensuring there's impact at the wider level beyond the immediate impact of changing men's behaviours. And then the second one is, how did you measure, and you're talking about these public events where men take part in cooking or caregiving activities in a kind of public forum, and were you able to measure whether men kept that up when they went back to their families?
Yes, I think this is a really excellent question. I think that many of the efforts that I participated and and have been involved do not allow for the rigorous kind of long-term evaluation to really look at the right after the intervention impacts by, for example, applying questionnaire or post-intervention surveys. In fact, I think that there is generally a challenge of sustaining these programs. As I said on the beginning, many men already are involved in the gender, in care work and responsibilities at a household level. They do share equally many of the practices at the home level, but are really afraid, fearing, or are not able for one other reason to speak out. So they will answer that, you know, I'm doing this and that, but in fact, I think many of these programs do not had an opportunity or do not intended to measure the long-term effects of this change. In terms of the kind of a cooking or of prevention activities or plans that have been one another way developed as part of the activities, what we see is that many of them are going on for a couple of maybe weeks or months, depending on the project duration, but unfortunately in a way are being scaled down. So there is certainly a need to go back to perhaps think about long-term approach, as I mentioned, with these programs, and ensuring that these activities which have a potential and actually shown to be effective are ongoing in the communities. In terms of the measurements, again, the programs that I participated have used mostly questionnaire or post-intervention surveys that have measured the kind of immediate outcomes on the attitudinal, maybe with indication on the behavioral changes, but have not been a kind of a long-term year or 2 years later.
Thank you. So I have an interesting question from Lorraine, who's asking whether women have any reservations about opening up traditional roles to men. And if you have any kind of sense of women, for example, when you're giving maybe the men cooking or changing or looking after the children, was there pushback from women in those cases?
Yeah, so I think that generally speaking, we do have evidence of a pushback from women. You know, the concept that you know, kitchen or household and caregiving is female responsibility only, that's her domain and so on. But in fact, I think that is slowly even the most disadvantaged or vulnerable communities changing, because as I mentioned earlier, women do increasingly are involved in income generation and paid income generation activities. They are stepping outside of the homes and participate in various activities. And there is a recognition for the benefit at the household level. So I think there are areas of that conversation or activities with men where there will be slight pushback. For example, cooking perhaps, or so on. But generally, I think the kind of key to it is that men and women are actually involved in some of these activities. So in the cooking demonstration, which I have described, we also have invited women to be part of it. So there was the level of support, there was a recognition of not taking over the space or the sphere of domain, but rather contributing equally, exchanging and stepping in when that kind of help of men is needed. So if it's done in this kind of collaborative and coordinated way, I think it has a potential to not to increase the backslash or pushback from women or any other way. Anyone else. If done in isolation, I think that creates more of an area of concern, perhaps you know, area of what the men are doing and what are they going to do in the kitchen or any other area, as a matter of fact.
Wonderful. I've got a question from Courtney, and she said, thank you so much for the presentation. And she really appreciated the example you shared from Papua New Guinea about men designing their own intervention. And she wants to know a little bit more about the relationship with the donors or partners and whether they had pushback, whether they pushed back because you were taking this flexible approach to program design.
Yes, so thank you for this question. Also very important. I think in terms of the funder or a donor, I haven't seen a pushback in terms of the type of activities that men will take forward. What I was referring to is more the, let's say, the time frame of activities or engaging men in a specific area that is of interest or priority to a donor, as opposed to area that is of a need to a local community and individual living in it. When it comes to the activities, it's more of the, I think it's more of the program design and actual implementation. I've seen in some instances that while some activities or some format of, let's say, prevention activity has been proposed, which has been identified as promising or, long, low-hanging fruit, always song, theater, performance is a very culturally relevant activity. Not all men's groups or individuals involved want to do that. Some of them want to create more of a march because they have been inspired by this by seeing it somewhere else. Some want to do more of a community debate. So I think that flexibility in terms of really listening to what the men groups, what the male participants, but also female participants want and need is needed as opposed to more of a what the program designer envisions is good for the community. Again, in terms of the donor pushback or priorities, I've seen it more of the health of a sector engagement rather than a specific activity at the program level.
Great, thank you. I'm going to ask you two questions at once now. One's from Oscar and there's another one from Courtney. And Oscar's asking about whether it's more effective to engage men and boys at an early age versus with older men. I think you touched on that earlier, but maybe you can talk about that in a bit more detail. And then Courtney's also mentioned the fact that some of the men and boys might be survivors of violence themselves and whether you incorporated that in any of the programming.
Absolutely. So let me start with the conversation from the question from Courtney. Of course, it is imperative to in any discussion with men in men's groups about violence, not to think that violence only happens to women and girls. Of course, acknowledging and recognizing the overwhelming rates, and of course, as I mentioned earlier, the fact that majority of perpetrators, especially sexual gender-based violence, are men. But men themselves do experience violence. They are constantly at a threat, so to say. Papua New Guinea is a perfect example of that, where violence against women happens at dramatic rates, but violence men on men happens also in a very alarming rates, where alcohol abuse and drugs cause men to fight, use machetes and so on to protect their pride and so on. So acknowledging and always keeping in mind that in the group there are men or might be men who have themselves experienced violence or may experiencing violence as they are in the program, and really treat this with a level of sensitivity, confidentiality, and respect. Being able to refer these men to appropriate referral resources and provide confidential, sensitive help is essential. So I would say absolutely important question and important step forward. In terms of Oscar's question, also brilliant one. I think it is imperative to start as young as possible. Young men, and we see this through the evidence, already are showing more gender equitable norms, attitudes and behaviors, and utilizing that and building off that premise is a very, very effective practice in changing men's and shifting some of the norms that uphold gender inequality. That also relates, that relates really across all of the sectors, perhaps with the health, much easier but very good question. Of course, start as young as possible, and install that positive norms in it, and uphold and build on the ones that already are more equitable.
Thank you. I'm going to try and squeeze in one more question before we end. There's been loads of great questions, so thank you. And thanks, Peter, for your comprehensive answers. The final question is about, it's in the context of preventing FGMC, but he specifically asked about how interventions might be seen as reinforcing men's patriarchal positions instead of empowering women and girls. I think that's something that comes up again and again. And he's asked specifically about what you would do about encouraging men leaders and how you might do that to prevent reinforcing men's patriarchal positions.
Yes, I think, there is a very growing evidence and of effectiveness that it really is not about portraying men as saviors and protectors in preventing violence against women and girls, but rather as partners. I think men have to be accountable and have to be held accountable to the patriarchy and upholding gender inequitable norms. But it is also not about giving them a status and kind of framing it as a survivor or protector, but rather as someone who is accountable and someone who has the strategies and skills to respond to it well.